This patient has been referred for the obstetric ultrasound and to rule out any adnexal or uterine pathology. So let's start with the cervix and then proceed further. This is the urinary bladder in transfer section, and this is the urinary bladder in longitudinal section. What are we seeing is that there is an approximately measuring be straight 7.4 centimeters into 6.6 centimeters evenly echogenic area that this area, echogenic area that starts from the vaginal region. This is the vagina, and this is the lowest part of the cervix, lowest most part of the cervix. Now it is elevating the cervix anteriorly, and whereas the posterior it is not depressing the cervical region. So the area of study is this evenly echogenic area with no significant posterior acoustic enhancement, with no internal calcifications or no solid element, is well demarcated and is in the region of the cervix. To my mind, there are two differentials. Either this is a bleed or this is a fibroid. Now, anyone who is seeing this video, I will request to comment and let me know if they have any other suggestions for my learning purpose. This is the longitudinal view of the cervix, where a evenly echogenic area is seen that elevates the anterior wall of the cervix. This is the anterior wall of the cervix, with no significant degree of posterior wall acoustic enhancement, and it starts from the most posterior part of the cervix. Here I am trying to align the vagina with this area. Now in transfer section, this area is showing the same pattern. This is the transfer section. And this is the cervix in transfer section. It measures 9.2 centimeters into 6.7 centimeters and is evenly echogenic, has no posterior wall acoustic enhancement. This shadow is that of a bowel and not from this echogenic mass. This is the bladder wall, and this is the urinary bladder in transfer section. So this is a questionable area relating to the cervix of the uterus. Now it appears to me in this section that it relates to the posterior wall of the cervix and measures 6.8 into 4.4 centimeters, whereas I consider this area to be elevated by this evenly echogenic solid area. Now this is the anterior part of the cervix, which is elevated by this solid, evenly echogenic, well demarcated area.